It's actually a nice time having us here again. And on today's discussion, we're going to be touching on difficult conversations as well as tough questions most persons are scared of asking. And I believe it's going to be a great and a beautiful time. That's why I will plead on uh, I will crave our indulgence that will try as much as possible to stay focused and stay concentrated from the beginning to the end of this discussion. Just before we do that, just a moment, okay? So I'm right back with us and we want to start up the discussion. Now, when our discussion today is around the doctor is not wrong. The doctors were actually not wrong. Why are we having this discussion? Why are we having this conversation? The moment someone is not feeling fine, the moment you have a client, a sibling, a relative that's not feeling fine, a lot comes between your mind. You're contemplating on the possibility of the person recovering. At the same time, you're worried about the cost of treating that person. And the greatest of them is the outcome. Most people mindset are about, is it possible for recovery? Yeah, there are conditions that may put you in that position where you start wondering, start contemplating, is it really possible for my relative to recover? And coupled with the expenses that you will need to make in between, most time can get persons agitated, can get some persons confused, can get some persons unnecessarily rude, and as at other times it may even get you very suspicious of almost everything, especially with the kind of questions people have confronted me, and they're like, there are some questions that doctors and nurses ask whilst the client is not feeling fine, and it looks a bit as very unnecessary. Some persons may not really understand why those questions comes in, and that's why we want to start this particular series on the aspect of history taking. Now, we may have heard that word history taking, and some of us, this may be the first time we're going to hear that word history taking. And I'm going to take my time to break down what each of them entails and when this is actually taking place, the possible questions you are going to be expecting, and why those questions are actually very necessary. For those of us who are just connecting, I really appreciate every one of us. It's so nice having us here, and I want to assure you that you are really going to enjoy your time on this very series. As I've said, the doctors were not wrong. Why? What are those things that makes up for this discussion? As I've earlier said, there are a couple of things ranging from the illness itself, the signs and symptoms that the client would face, and then the possible outcome of that illness might be the challenge that most persons would find themselves being irritated, and unrest, as well as suspicious of almost everything. So we want to start for today's discussion the aspect of history taking. What exactly is history taking? History taking simply means the collection, the procedural, the step-by-step approach in taking information about the client that would lead to the possible cause of the illness and then a better treatment plan for that client. That's what history taking simply means. So in this very discussion, you permit me to use my local language at some point because I'm looking at the universal community. So I want every person to understand this very discussion as basic as possible. So as I've earlier started, what is history taking? So history taking, as I earlier said, is the procedural step-by-step approach in gathering relevant information about the client. So what I simply mean is that for you mama and papa out there, history taking simply means say those questions wey dem go ask you, those simple questions wey dem go ask you, sometimes e fit dey very difficult. Those questions wey dem go ask you about yourself, sometimes about your brother, or how the disease condition take start, na im be history taking. So history taking simply means those questions that you be asked about that health condition, how it started, what are the things you have done so far, and what makes up. Why do we take history? Wetin make what we dey collect history from clients? First of all, we have 5 C's that are very important that we understand, so that when we ask these questions, it will be you'll be very comfortable to give out this information. What are the reasons? The first one we have the chief complaint, which is the main reason why you came to the hospital. So chief complaint simply be that very reason, that thing will make you come hospital. There is something that actually bring you to the hospital. It is not all the symptoms that actually brings a client to the hospital. It is the most serious one that brings the client to the hospital. Thank you everyone for connecting. I can see all of us. If you're just connecting, do well to like the live stream. Please do well to like the live stream. And where you have questions, please do well to drop the questions in the comment box. I'll really appreciate to answer all our questions. You can ask the difficult questions around this particular topic. As I've earlier said, this particular series is all about difficult questions that clients are actually afraid or scared to ask. So please ask those questions in the comment box. I'll address them as we proceed. So I say chief complaint is the main reason that makes you that you feel it is time that we go to the hospital. So chief complaint simply means that thing will make you when you say abeg my body don too pain me, or the way this thing dey go I no understand. That particular reason is the chief complaint. The second reason why we gather history is the cause of the illness, which is how that illness take start. How did the illness start? From when did it start? Wetin you don dey notice when this illness start? What are those things you have noticed? And how e dey do you? How does it occur from day one up until this point? Wetin you don notice? That is the cause. That's the second reason why we take history. First one, I say chief complaint, wey be the main reason why you come hospital. That main reason why you came to the hospital is the chief complaint. Why the cause of the illness is how the sickness take start. How did the illness start from day one till this particular moment? Wetin you don dey notice? Oh, my sister, thank you so much. Thank you so much for having me here. Thank you so much. My sister, don't mind me. Today, I decided to use the simplest English or the simplest language that I can. I want everyone to actually understand this discussion. So this discussion is simply all about those difficult questions that persons are not or they are scared to ask. Especially, there are people that they will see their clients and they are scared to ask the doctor, are you sure this my client go recover? Is they sure say this my client, or is they sure say I go recover? Those questions are why we have this particular series. So if you have any question around there, you can drop it. My sister, thank you so much. Thank you so much. I really appreciate for always having you here. I can see all of us. Do well to like the live stream. Thank you so much. So we say the main reason why we gather this information, because sometimes for most of us, you go dey ask, say, this patient, why this doctor no wan attend to this patient? E dey here dey ask me unnecessary questions. E dey here dey ask me stupid question. Which kind of thing be this? Which kind of doctor be this one? The reason why we ask these questions are, first of all, the chief complaint, which is the main thing wey make you come hospital. What is that main reason why you came to the hospital? The second one is the cause of the illness. How the illness take start? Wetin you don dey notice as the thing dey occur? Wetin you don dey notice? If e dey pain you, where e dey pain you, and so on. Those are the things we look for, the cause of the illness. As those things will help us now look for the cause, which is wetin make e happen. What is the reason why that sickness happen in the first place? Wetin make wey e really happen? So that is the third thing that we want to get. Now the third reason why we dey ask all those questions, wetin make the sickness start? So the fourth one is the complications. Wetin be other things wey you don notice wey dey very serious, wey you dey even fear? What are those other things that you have noticed? That is the fourth reason why we ask all the questions that sometimes some persons may be stressed out. You can also share your experience in the comment box. about this history taking I'm talking about. When you are just getting to the hospital, they'll tell you go and buy folder, go and buy card, go and buy this, and then even when you have gotten it and come, the doctor will now still be asking you questions. Sometimes you may feel irritated with those questions. Let me know, what is your own experience? How was it like? So we say the fourth one is the complications. Wetin be other serious thing wey you don dey notice, wey you dey even fear? Those are the complication. And then the last reason why we ask those questions is the care received. We wan sabi wetin you don do on your own part before you come hospital. Wetin be those things wey you don do before you even come the hospital? What are those things that you have done? That is the fifth reason why we ask some of these questions wey look like say na stupid question. One, I say the chief complaint, which is the main reason, that main reason why you come hospital. Number two, the cause of the illness, how the thing don dey happen, wetin you don dey notice. And then number three, what is the cause, wetin make am make e happen. And then number four, the complication, those other things, those other serious symptoms, those other serious signs wey you don dey notice. Na be the reason why we dey ask those questions. And then number five, na the care wey you don receive, wetin you don do on your own part. Some people will tell you, I have gone to the hospital. Some people will say, I went to the church. Some people will say, I took enema, which is for pidgin English, they will tell you, I don pump the pikin belle. So some people will tell you they have taken enema. Some people will tell you, I have taken paracetamol. Wetin be those things we don do? So we wan know. This thing now go come help us. These are the things that will help us to know what to do from the, because what you have done, that thing we don do, if for you, you feel say you never really target the sickness the way you want am, but in the real sense no be like that, because that thing wey you don do, e don either reduce the symptom or increase the symptom. That's why we wan know wetin be the thing wey you don do. So that will now take us to history taking properly. What are those questions that we ask, and why do we ask those questions? So we go consider am history taking. I don start to define history taking. I say na those information wey we dey ask you about yourself, about the sickness itself, about the family, your own family, about everybody around you, the kind of place wey you dey work, the kind of place where you dey stay. All those questions are what we call history taking. Because the place where you dey work, the place you work, the kind of your educational status, the school wey you don at ten d, dey play role whether the sickness go fast, the sickness we go fit treat am, or the sickness na something wey we go refer. So the number of persons, the kind of family, is it a polygamous family? How many wife? Dem go ask you sometimes, how many wife wey your father get, or your how many number what child wey you be for the family. All of them get a role. One of those days, if you check my video, I have taken time to explain that the position where you be for family get a role to play with some mental illness, especially the first child and the last child. The first child and the last child. The first child really gets association with certain type of mental illness. So that's why we ask some of these questions. Please, I really appreciate our presence here. Thank you so much. I can still see us. As you are connecting, please do well to like the live stream. So what is the first major thing that we'll get? First one is that you'll see we have the aspect of physical examination. Physical examination. What is physical examination? Physical examination has to do with the systematic head to toe or toe to head, system by system assessment of this client. Wetin e mean? E mean say physical assessment simply means say the checking, that checking wey the doctor go check you from your head to your toe, from your toe to your head, one system to another. That particular step by step approach na im be the physical examination. That is the physical examination. So some people, you go see say if na man na im dey check you, if it is a male that is checking you when you are a female, you feel uncomfortable. And that's why some people, if they have issues that have to do with the reproductive tract, they don't feel comfortable to express themselves. They don't even know because they are shy. Some of them go even ask, is this thing really serious? That's why some people have really accused the doctors. They say, that one sabi follow woman. That one wey dey do anyhow with woman. Sometimes the doctor is checking you, not what you are thinking. Most time it is not what you are thinking. So that checking wey dem dey check you from your head to toe, or sometimes dem go tell you pull your cloth all, sometimes dem go tell you pull only your trouser, sometimes dem go tell you pull only your shirt. It is physical examination that they are conducting at that point, and it can take different pattern. There's one that has to do with the observation sight. They use the eyes. The doctor will just look you from head to toe. That one is another pattern that they can assess you physically. What is he looking for? He's looking for things including the way you dress, the way you dey talk, your body. You get tattoo. Do you have tattoo on your body? Do you have scars on your body? Is there things like injury on your body? We want to check this thing to show if it really connects with wetin dey do you. So is there scars on your body? Are there bruises? And then how are you dressed? You should tell your mental state. How are you dressed? Are you dressed scattered? Are you dressed shattered? How exactly are you dressing? And then the kind of odor that comes from your body. Then your hair. How is your hair like? The doctor go check all those things. Your nails, the color of your eyes. The doctor will check those things. The color of your eyes. Sometimes they will walk close, raise your eyelids and so on, because your internal organ, how that's your system, those organs inside. We can actually tell the state of those organs with things outside. For instance, your eyes can actually tell the state of your liver. Your eyes can tell the state of your liver. Looking at your eyes, through the color of your eyes. The pain you have on your shoulder can tell a pain that is coming from either your heart or your liver, sometimes your gallbladder. So that's why they will check all of these things. We call them physical examination. Another approach they can use, there's what we call palpitation, where they will check, put two fingers, tap am, tap am. There's what we call auscultation, where they will use the stethoscope to check, is there any sound coming from that place? What is the pattern of the sound? And so on. So those things are all physical examination. So having understand physical examination and the things wey we dey expect, if you don understand that one, we will take to the next one, laboratory investigation. Now, I really understand with us that healthcare services are getting expensive by the day. I really understand with us that healthcare services is really getting expensive by the day. That's why some people are worried that before they even attend to them, the kind of lab tests, some people want to avoid those lab tests. They no wan do some of those lab tests because of the amount. Some people are scared that even after the lab test, they may not even have the money again that is left over to attend to the disease condition that brought them to the hospital. And because of this reason, some people will start avoiding certain lab tests. Sometimes some people will get offended. Some people will be like, but I don't already do this lab test now. Why you dey still ask for am? I will explain why we ask for a particular lab test. When we get to this point, I will explain why we ask over and over again. I will explain each of them. So what you will do for me, just patiently stay along, drop your comments anywhere you have question. Also, let me know where you do not get it so that I can rephrase it again in the comment box. If you are just connecting, do well to like the live stream. Please do well to like the live stream. So, we said that we are talking about this lab test. Now, some of this lab investigation, there are things that you cannot directly see on the client and then know the cause of that illness. You need to do lab tests. And at the same time, e no mean say na every sickness that you need to do lab tests. Some sickness, just looking at the client and the kind of complaint, you would know what exactly is wrong. And that's why you go to the hospital, sometimes they will not ask you to do lab tests. But it does not mean that every time you go to the hospital, the doctor no go talk say make you do lab tests. There are some times that it is not necessary because of the complaints that you will give. The doctor can easily tell, okay, this one is malaria, this one is typhoid, this one is gastritis, this one na cholera, this one na diarrhea, this one na this. It is because some of them, the doctor can use his professional skill to know that you don't need a lab test. If they even would need those lab tests, it's just to know the severity. So sometimes, even when the doctor don't get am, it may just be the doctor want to know if the sickness really serious, how serious the sickness really be. So that's why they will still ask you to do lab tests. Lab test is what will confirm, most of this illness. So it involve lab test still fall under history taking. So dem go ask you which test you don do before you come. What are those other investigations that you have done? What were the results of those investigations? Which ones have you ever done when you first had this sickness? They will ask you all those questions under history taking. Then the next question they'll ask you is radiographic investigations. Now, there are some sickness wey be say lab test no go show them. There are some sickness that lab test will not detect their presence. So what will actually detect it accurately is the radiologic investigations. So this one na that one wey be say dem go carry something place for your body or put you for one room, tell you make you breathe in, breathe out, and then dey snap you. So that those are radiological tests, the ones that you go and they use x-rays, they use sonography, different type of them. Those ones fall under radiological study. This one will give a visual view, so that it will help for the doctor to really appreciate the nature of the sickness, where it is actually occurring, and the damages it have caused. Those are things that the radiological investigation will show. So I don't know if we have gotten it up until this point. If you are really following up with me, let me know in the comment box. But if you have been lost at any point, also let me know in the comment box. And if you are just connecting and this is your first time here, do well to subscribe to this channel. At the same time, do well to also like the live stream. I really appreciate. Thank you everyone for connecting. So we'll move to the next one, which is presenting complaint. Presenting complaints, another thing that the doctors will gather during history taking. Now, don't be offended. No feel bad when the doctor don for you, you go feel say you no dey see the person dey bleed, or you no dey see the person dey in pain. Why you still dey ask me how the pain dey do and so on? Why we ask all this question around presenting complaint? One is to know when it started, how it started, where it started, things that you have done when it started, things that help you to relieve some of those symptoms. We want to know all those things. That's why we're asking. The presenting complaint are those things you have noticed. Now, in taking history, let me just go a bit further because I'll still come back to that. There are things that we call subjective data, and then there are those ones we call objective data, right? Subjective data are those ones that only the client can tell you, while objective data are those ones that you as the trained physician, you can see them. You don't need the client to tell you. Now, what does it mean for those my people that maybe in the local settings? Subjective data na that data wey be say you go tell the doctor. That particular data wey you go tell the doctor, that information, those things wey you go tell the doctor, na im be subjective data. While objective data na those one wey the doctor see am by himself. Those one na im be objective data. Objective data na those one wey the doctor go see am by himself. So when the doctor dey ask you this question, he may want to be gathering subjective data and not just objective data. So that's why you need to open up, tell the doctor every single information, how e dey do you. That's why I used to ask some questions, say, if your head dey pain you, you now dey hospital, you don finally go hospital, you come tell the doctor say, na my leg dey pain me. When you dey think say the doctor go treat, na your leg abi? That's why you need to tell the doctor how it is doing you, where it is doing you, and when it started, and every single detail, so that they will not be treating the wrong place. They will not be handling the wrong diagnosis. Diagnosis simply mean the real thing wey the doctor dey treat. Do you get? So that is what we gather in presenting complaint, which involve what? The onset. Onset simply means when it starts. The second one na the characteristics of the illness. Characteristics of the illness simply means how the thing dey do you. How is the illness starting? Some people go tell you say, e dey pain me for here well well, or this side na im dey really pain me, or I dey always feel headache around 8 o'clock in the evening, or when I sleep wake up I dey always feel tired, I feel very tired, my body go pain me. That is what the characteristics of the illness. Some people go say, I notice say my stool dey always dey very dark, or my urine dey always dey very green. That is the characteristics. Then the location, the place. Location simply means the place that is actually affected, or the place that you are feeling the pain, the discomfort, and so on. That is the location. The next one is the severity, which is severity simply means the how it is, the intensity. For my local people, it simply means how e dey really pain you, the way e dey really do you. That is the severity. The next one is the aggravating and exacerbating factors. Aggravating simply means if it is paining you, what are those things that you do, and then the pain will reduce, the symptom will reduce. The doctor will want to know those things. So aggravating pain, e simply means say wetin be those things wey you dey do when you dey feel those pain, wetin be those things wey you dey do. And then the exacerbating simply means those one wey be say if you do, the pain go increase. Some people tell you that if the thing starts now, if I stand up start to waka, I dey feel real pain, or if I lie down I dey feel real pain. That is the exacerbating factor, which may be a result of position, result of activity, a result of thought, and so on. So those are things we want to get under presenting complaint. That will take us to the next one, which is the past medical history. Past medical history is another one that some people get bored. They'll ask you, maybe you came in with complaint of appendix. The doctor will come, they ask you, you don't ever get malaria before? Have you ever gotten headache before? You will now start asking, what is the relationship between appendix and malaria? What is the relationship between this? All you need to know, wetin you suppose sabi say, your system dey connected. Your system na one house wey be say if one thing affect one side, e go affect every other side. That's why you see say if you get headache, you no fit even concentrate do other things. Or if your finger dey pain you, e dey like say na your entire system dey pain you. That is why we talk about what? The past medical history. That's the reason why we talk about past medical history. Past medical history will give us things that have happened in the past that you thought it have resolved, but is the reason for this current complaint. That is what the past medical history will reveal. Those conditions that you had in the past that you may not know is what have led to the complications you are facing today. So malaria can aggravate to something else. Taking of alcohol can aggravate to something else. So we want to know those past medical history that you have had. Is it diabetes? Diabetes can lead to something very serious than you have thought. Hypertension can lead to a very serious condition than you expect. That's why we want to gather what? The past medical history, which will include some of the illnesses you have ever had in the past. You go tell us those sickness wey you don ever sick. Some people na chicken pox, some people na TB, some people na malaria and typhoid, some people na cholera. All those things you have to tell us those illnesses. The next one is the surgeries that have been conducted on you. What are those surgeries that you have undergone before? Some people, you will see they have done appendicectomy, they have done herniorrhaphy, they have done different surgeries. And those surgeries, as a result of doing those surgeries, are the reason why you are having this newer health condition. I don't know whether it makes sense to us. So why we gather the past medical history, for instance, surgical interventions that have done on you, is because it would help us to relate the current illness you are having with the past one you have had. It makes sense? Does it make sense to us? Let us know in the comment box, please. Let us know in the comment box. So we have said, for those persons who are just connecting, on this very series, For those people who are just connecting, on this very series, we are talking about those difficult questions, those hard questions that you are scared to ask the doctor. Sometimes you don't even know how to ask the question. Those are the questions we are expecting on this series. It is all about the doctors were not wrong. Things that you see the doctors do, the healthcare personnel, the nurses, that you thought they were wrong for doing it, but you did not know that it has a major function towards, or it plays a major role towards your recovery. Those are things that we are discussing on this very series. So if you have any question around all of this, please let me know in the comment box. And if this is your first time of visiting this channel, do well to click the subscribe button. At the same time, do well to like this live stream. I will always love and I appreciate seeing us coming over and over. Now, the next one is hospitalization. Some people may have gone to hospital before and spent 3 months, 4 months because of a particular illness. So we want to know how frequent is this person going to the hospital. Some people will say, anytime you see me lie down, no say the sickness really serious. That would show how some people cope, their coping mechanism towards certain illnesses. So it will help us, guide us to know how people react and what led to longer hospitalization in that particular episode where you had. So we want to know things about the frequency in the hospitalization, the type of hospitalization, and every single thing. So does it make sense to us? I really appreciate us. Thank you for the thumbs up. Thank you for liking the live stream. I really appreciate every one of us. If you are yet to, please do well to also like the live stream. So the next thing we want to know is the aspect of any significant health issue. Now, there are some people that will have hypertension, will have diabetes. Now, someone have asked me before, is it possible for someone to have hypertension and then you will not have diabetes? Or is it possible to have diabetes and then you will not have hypertension? So make I answer that person question. Yes, it is very possible say the moment you have diabetes, one day you go get hypertension. It is very possible because say wetin dey cause diabetes na sugar. Abeg, no be spiritual attack. Diabetes no be spiritual attack. Diabetes na when you get plenty sugar for inside your blood, na im be diabetes. So when you get this thing, plenty sugar for your blood, you go get diabetes. Now, wetin be hypertension? Hypertension simply means say the way your blood vessel, those your vein and artery, all of them, something don block that artery and the vein, and because of that, blood no dey flow very well. The way e dey take enter, dey flow, e dey cause plenty pressure, na im be the blood pressure. That pressure wey because the blood vessel dey block, na im be the blood pressure. I don't know if this makes sense to us. So the moment you have diabetes and you have been confirmed with it, it is possible that you will come down with what? Hypertension, because sugar will block the blood vessel. Increased sugar will block the blood vessel. Now, is it possible to have hypertension and you will never have diabetes? Yes. Because hypertension simply means increased pressure. So anything outside diabetes can cause increased blood pressure. So the fact say your blood pressure dey high no mean say you get diabetes. The fact say your blood pressure dey high, e no mean say you get diabetes. But the fact say you get diabetes, e fit dey possible say your blood pressure too e go high. The fact that you have diabetes is possible that your blood pressure may be high. So are we still there? Please let me know in the comment box. Are we still there? And do we really enjoy this section? Please let me know in the comment box. I really appreciate. Thank you for connecting. And I don't know where you are connecting from. Let me know in the comment box where you are connecting from, and let me know what you are learning in this very section. All right, the next one have to do with the complications that those other sicknesses have caused in the past. Sometimes they will ask you, how serious was that chicken pox? Did it lead to something else? Wetin become? How it been end? Those are things we want to know under complication. And why do we need to know those things? So that any other sickness that comes, want to relate, is it because of those complications That's why you are having this particular sickness. That will take us to the next one, which is the prognosis and outcome. Those past sickness you had, what were the chances that you recovered? Did you completely recover from them? Or did that sickness lead to something else? Some people will tell you, because there was a delayed illness, because there was a delayed delivery, I noticed that the child could not work on time, did not perform well academically. Because delayed delivery can starve the brain of the child, it will deprive the brain of oxygen. And anything that will deprive our brain of oxygen can lead to severe mental complications, because the brain survives on two major things: liquid and liquid and what? Oxygen. That liquid in form of glucose, which is glucose and what? Oxygen. Those things, your brain do not play with them. Two things that really consume oxygen and glucose in your system: your brain, your liver, because they do a high degree of work in your system amongst every other organ. Your brain, the kind of work your brain does, it is the highest consumer of oxygen and glucose. So we want to know, so that we'll be able to relate it. That will take us to the next thing under what? History taking, which is what? Disability and genotype. We want to know, is there somebody in the family that have had one form of disability or the other? You yourself, when they report, you get any form of disability or the other. Then the genotype, area of genotype, what are we searching for? Especially for couples, when we are counseling them, we want to know your genotype, because there are certain genotype that they cannot marry together. There are certain genotypes. Someone who is AS and another person is AS. We want to counsel you first if you are really ready to go into the marriage or not. Someone that is SS and SS, those one is a no-no. It's a no-no. But can AA and AS marry? Yes, absolutely yes. Can B and yes, can O and any other one marry? Yes, they can marry. So do we get? Sometimes I want to know in terms of transfusion too. There are blood group that cannot accept. There are those ones that cannot give. So O positive can actually give blood to anybody at all. Anybody that is O positive group can give it blood to anybody. And then somebody that is ABO can actually receive blood from any blood group. So that's why we ask some of these questions. So when they ask you, no be to make you feel uncomfortable. Na person wey hide in disease condition, na im dey quick die from disease condition. That is an old adage from where I come from. So somebody that hide the sickness will end up suffering from the result of hiding the sickness. So when they ask you some of these questions, it's not to make you feel uncomfortable, but it is towards making a proper diagnosis and then for accurate treatment. I don't know if it is making sense to us. I really appreciate every one of us connecting. Do what to like this live stream, please. Do what to like the live stream. As I've earlier said, on this particular live stream, we're talking about every difficult question that you find sometimes uncomfortable, you find it uncomfortable to ask when you are before your clinician. Those questions, those things that you are passing through health-wise that you cannot talk about, let us know in the comment box. We are actually going to address them on this series. So the series is titled, The Doctors Were Not Wrong. Looking at tough questions, considering tough questions we couldn't ask. We are scared of asking. That's what we are actually addressing on this particular series. So this is the first episode on the series. The next one have to do with family history. And on it, we are talking about the aspect of history taking. Now, some people feel uncomfortable. Some people hide some information. Some people feel some information are too private for the doctor to ask, for the nurse to ask. They feel the information is too private. Why you ask me this kind of question? How it relates with my condition? How does it relate with what I am suffering now? But I am letting us know that all of these things, your system is associated. They are one. What will affect one part of your system will affect other part of your system. And that's why we ask series of this question. Now, we move to the next one, which is what family history and genetics. One condition that happens to one person in the family have the possibility to also occur in the next person. Instance, sickle cell. Instant, albino. Instant, diabetes. Instance, hypertension. So if you don see one person don get hypertension for house, e mean say e dey possible say another person from that same family fit get hypertension. If you don notice say one person don get diabetes, e dey possible for another person to also get the diabetes in that same family. But can somebody in that same family stay without having the same condition? Yes, absolutely yes. So when you see somebody in your family that have one disease condition, it doesn't mean that you will immediately come down with that disease condition. It's only a signal for you to be careful with your own life. Sometimes you may need to adjust your lifestyle. You may need to adjust the kind of work you are involved in. You may need to adjust the kind of partner you want to marry. You may need to adjust the kind of life you want to live. So that is why this particular family history is important. It will also guide the clinician when advising you, when counseling you on things you need to do away with. Because some sickness, some people suffer. The cure to it is just preventive. It is just to avoid. Just avoid, keep away from. And you will stay healthy for the rest of your life. So that's why we ask questions around family history. And also, the way one person responds to treatment, it's possible that the next person in that same family will respond the same way. The way one person reacts to one medication, it's possible another person will have the same allergic reaction. So that's why we gather history on the family, from the family. We have two things about your family. So don't feel uncomfortable that how does it relate with my family? This thing why they pass through now, how it take relates with my family. Please, I don't know if this explanation is actually making sense to someone out there. Please let me know in the comment box. If you are just connecting, do well to like the live stream. I really appreciate our presence here. It's actually giving me the courage to continue on this series. And that's why I plead that if this is your first time on this channel, do well to subscribe to the channel so that as we proceed on this particular series, you start and also end with us. Okay, so we move to the next one, which is social history. Now, under this social history, we'll gather things such as the type of occupation, the type of job where you dey do. It also going to determine the type of sickness that you are prone to. Let me give us an instance. Somebody that is working in a construction company, what are the possible illness the person is prone to? One, accidents and injuries. The person is most likely going to have dislocations and fracture. The person can also fall from height. The person can have sprain. Now, somebody that is working in a chemical producing company, what are the possible illness? The person can have genetic mutations. The person can have chemical intoxication. The person can have food poisoning. Those are the possible things that relate with the type of work you do. Somebody who work in a radiologic environment, what are the genetic mutation is one of those instances. The person can come down with cancerous conditions. So that is how your work relates with the kind of sickness you can come down with. Somebody that is a hawker, can the person do the person have certain illness he or she is actually prone to? Yes. The person who is prone to, for the African setting, because the plasmodium organism is actually residing in the people, especially the West African bloodstream, it is possible for it to come down with what? With malaria. And because this Salmonella typhi is actually resident in most of the African bloodstream, so when you are exposed to harsh condition, it awakens those conditions such as typhoid. It awakens conditions such as what? Such as malaria. And then people who work in breweries, those people that work in drinks companies that produce drinks, wine, alcohol, and so on, they call the breweries, right? What kind of conditions are they prone to? They are prone to substance use. Because where you dey work, they say where you dey work, night you go dey chop. That's why they call am work chop. Work, shop. So when you dey work, na you go dey chop. So if you are working in company that produces alcohol, it is possible for you to come down with substance uh, abuse as a condition. So the type of work you do, if you are a military person, what are the possible ones? Because you are prone to war zones, so it's possible for you to come down with gunshots and so on. Does it make sense to us? So the type of work the individual does would also determine the kind of hazards and the kind of conditions the person will come down with. And that's why we ask questions around your occupation. The next one is the living situation. We have some disease that we call non-communicable disease, and we have those one we call communicable disease. So if it is a communicable disease, what are what are the examples of communicable disease? We have tuberculosis, we have cholera, we have as you call chicken pox, we have Lassa fever, we have Ebola and so on. Those conditions wey be say e fit spread, e fit easily spread even out of control, we call them communicable disease. But those ones wey e no fit spread, those ones are actually non-communicable disease. And then the third one is actually the sexually transmitted disease. This one only do with what? Sexually, can only go through sex, right? So those are the three major subclass of disease condition. Communicable are those ones that can share from one person what to another. Non-communicable are those ones that cannot be easily shared, in the sense that what are the possible example of non-communicable disease? Malaria is an instant. Hypertension is an instant. Diabetes is an instant. It's not a communicable disease. Do we get? And I already know, we know the other third type, which is what? The sexually transmitted or venereal disease conditions. Now that will take us to what? So before I move to the next one, the living condition of the individual will help us know if other persons have contacted the disease condition, or the person that is in the facility, the healthcare facility, is it getting the sickness because of the condition, the environment where he or she is coming from. All right? So that is why we ask questions around the kind of house, how many people dey the house, you and who dey stay for the house, all those questions. That's why we ask them. The next one is what? The lifestyle of the person. Does the person smoke? What type of lifestyle? Is the person a social type? Is the person a reserved type? Especially in mental health diagnosis, your lifestyle really plays a role. All right? So we'll ask questions around there. The next one has to do with alcohol consumption and other lifestyle habits, which I've already talked about. So that will take us to the next one, medication history. Which medication wey you don dey take before now? Which medication you dey use anytime you see this kind of sickness? What type of medication do you use? How do you get those medication? Is it self-prescription, or it is which we call self-medication, or it is over-the-counter drug prescribed by a non-health personnel or prescribed by a healthcare personnel, but you get it without being admitted or without being seen in the hospital? So those things we want to gather under medication. What are the doses that you were placed on? What is the dose? So that when we are now giving you similar medication, we'll try to look at the angle of tolerance, the angle of dependence, the angle of addiction, and then we'll see how to manage you very well. That will take us to the next one, called allergic reactions. That's another thing we gather under what? History taking. Some people actually get allergic to medication such as aspirin, some people quinine, some people chloroquine. So we'll ask you this question to know, so that when we are making prescription, we'll be guided on the type of medication that we'll use for the client. The next one will be review of systems. On this one, I earlier said it, which falls under what? Physical examination. This one is where most people feel uncomfortable. For instance, if it is a gynae doctor you are meeting, and the doctor maybe was a male doctor you met, the doctor is massaging, you may feel uncomfortable in some instance. Sometimes you might even get excited and you'll be thinking something different from what the doctor is thinking. Because what he is doing is assessment by what? Palpitation. Palpitating the side. Is checking. It's just checking. It is not what you are thinking. Is it clear? So that is what under systemic review they will check you from what? From they will check you, sometimes they will check your respiratory system, sometimes they will check your cardiovascular system, sometimes they will check your alimentary canal, which is the digestive system, sometimes they will check your reproductive system and so on. Each system for a system. They ask questions around there. Why are they asking this question? Because one affectation in one organ of that system can result in what we call referred pain. Referred pain is a pain that you have it in one point, but you are feeling it another point. Radiating pain means the pain that spread across, not just one side, is spread across other sides. And then when I have what? Associated pain, which is a pain resulting as a result of other disease condition. You get? And then when I have what? Phantom pain. This one is the one that the client is having. It's called psychological pain. It's not as if what is the pain is actually there physically. The pain is not there physically, but the client feels the pain. It is called phantom pain. Alright? Phantom pain is that type of pain. That pain where you dey feel, wey be say the pain no really dey physically, but na your mind dey deceive you. Your mind dey make you feel say you dey feel that pain. It is called psychological pain. So that pain is called phantom pain. And that will take us to another thing under history taking called the patient perspective, which will classify it as idea, concern, and expectation. Now, under idea, concern, and expectation, wetin we define from there? We want to know what is your own knowledge about that disease condition, and we classify them under judgment and insight. Wetin be your own knowledge? Wetin you think about your condition? Wetin be your knowledge? Wetin you know about that particular disease condition? And then e go now help us to guide you, to educate you one after the other about the condition, wetin you need to know. So what is your idea on the disease condition? The next thing we look under there is what your concern. Wetin you dey fear? Wetin be your fear about this condition? Wetin you dey fear? What are your concern? Then the last one is now the what? The expectation. Wetin be your expectation at the end of the day? If we now finish this treatment, wetin you dey expect? Some people will feel, there are clients that will tell you, I feel like sleeping and then ending everything. That will help us to know the severity and how it have affected your mindset, and then we'll start working with you psychologically. Thank you so much. Thank you so much. Make money with favor. It's been a long while. Thank you so much. I'm really excited having you here. Thank you so much. So we're actually on a series called The Doctors Were Not Wrong. And what are we looking at on this series? Those difficult questions you are scared of asking during your visit to the hospital. Those ones, there are people that will go to the hospital, some complain, they can't tell. Especially those ones that have to do with the reproductive system. You are scared. What if, how will the doctor look at me? Or if the doctor, my husband no go gree me look. In fact, let me give us a funny scenario, a funny example using my brother. Okay, my brother's fiancée, actually, she was having a particular condition that had to do with the reproductive tract, right? And then she asked me, these are the symptoms that I have. What do you think? I have already known it, but I didn't just want to work on how is it called? On suspicion or assumption. I say, go and do lab test. And then when you do the lab test, at the same time, make them check you. Then tell me the things wey dem find. So I did not tell her the things that you will be seeing, so that she will not just go and start telling. I want her to expose everything, so that when she's telling me back, it will now confirm what I am expecting. So go and let them. So when she reached, they were supposed to take vaginal swab from her. Vaginal swab is when they use that stick, that white thing that look like stick, and then they'll put in the vagina and then remove it and then take it to the lab for investigation. My brother's fiancée started acting drama. This guy, they find me. This guy, say this. She came back. She did not allow that investigation for that day. They did not take that sample. She came back and fire. Do you know what I passed through? This is this and this and this and this and this. When she said that everything finished, I laughed. After I laughed and finished, I said, that thing he was doing is not what you are thinking. Before they can take that test I told you to go and do, it is expected that they will do those things that you think that he was too much. He was already, he said he already challenged that, my brother will not allow somebody to touch his girlfriend like that too. My brother will yes, so make money with favor. Yes, that's why we have this particular series. So you tell us those things that you are scared of telling your clinician. So at the end of the day, after I counseled her and everything, she later went and did the test, and then the result came out. So that is an instance of most people not feeling comfortable even when they are passing through a severe health condition. They are not free to open up. Some of them are shy. Shyness have caused most person. They give a wrong symptom, and then the doctor will end up having a wrong diagnosis. Anything. That's why I started by saying, if your head is paining you, you tell the doctor, say, na my hand dey pain me. Wetin the doctor go dey treat? Na your hand, no be your head. So the doctor will have a wrong diagnosis because the symptoms that were gathered are wrong symptoms. So that's why the doctor will ask some of these questions. They will ask you things around your expectation, your idea about the condition, your own concerns about them, and so on. So thank you so much, everyone, for connecting. I really appreciate our presence. And I hope this particular section is actually making sense to us. Let me know in the comment box what you have been able to gather. What are the things you have been able to learn? So we're moving towards completion of this discussion. But before then, we want to take another one, which is where we are going to be drawing the curtain. Or the types of history taking. You see, that's why there's female doctors too, if you are not comfortable with male doctors. Exactly. So if you are not comfortable, that's a good one that most people need to know. If you are not comfortable with a male doctor, if you are a female, you can always ask for, you have that right. It is among the patient bill of right to be able to select the caregiver. So you have the right to ask for a female doctor to attend to you, and vice versa. That is, if you are a male too, you can also ask for a male to attend to you. At the same time, if you are not comfortable with one person, these days the world is getting very funny. So if you are not comfortable with one person, you can also ask for the second or the third person, which we call chaperones. You can ask for a chaperone to be there while the doctor is attending to you, or any other healthcare provider. You can ask for a chaperone to be there. So thank you so much, Make Money with Favor. I like that particular contribution. So the next one we'll say is the types of history taking. There are different ways that history can be gathered. I've said that earlier. We have the direct, we have the indirect. Exactly. So we have the direct, we have the indirect history taking. So the direct ones are those ones that will get it through you, that is present, you that is the person suffering that disease condition. Then the indirect ones are the ones that will get from lab tests, radiologic studies, that will also get from things such as your relative, other people outside you. Any other thing that will get outside you is what? The indirect way of gathering history. That's the indirect way. Then the next one have to do with what? Subjective and objective history gathering. Subjective are those ones that you will tell the healthcare provider. Why the objective are those ones the healthcare provider does not need you to tell him or her. For instance, the vital signs, where they will check your BP, they will check your height, they will check all those things. All those ones are what? They are objective data. Those ones, all those ones, when the doctor look at you from head to toe, will assess you and check all those things. Those are what? Objective data. That the doctor does not need you to say anything to be able to know what is wrong. Why subjective data? Those ones you will need to tell the doctor. Thank you so much, everyone, for connecting. I can see all of us. Please, if you are here to like this live stream, do what to like the live stream. There are lots more that are coming our way on this particular series. So that will take us to the next one. What are the types now? We have what we call emergency history taking. This one is where, for instance, the client came in, is all weak and almost unconscious, or is unconscious, or the client came in from an accident scene. The kind of questions that will be asked here are called emergency history taking. In this type of history taking, you are only asking the most important things. So the doctor only asks you the most important things. So please, when the doctor is trying to gather this information, don't be too quick to say, why is the doctor disturbing me? Why is he bothering me with this client? Are you not seeing this client is going already? Can't you just do something? The doctor need to ask some of these questions. Sometimes they need to ask, gather history because of legal implications. May need to ask, where did it happen? Sometimes it might be a robbery scene. Sometimes it might be different, so that the doctor also will be on the safe side. That's why some of these questions are asked. I don't know if it makes sense to us. So that one is called emergency history taking. But it does not mean that those questions that he have asked you on that first day is all the questions that he will ask you. There are other types of history taking. There's the one called focused history taking. This one have to do with a specific, is looking for a specific, you already have the condition in mind, but you want to ask you questions that relate to that particular condition. Or what is doing you is at a particular point, let's say your hand, you want to ask you questions that have to do with that condition that can affect your hand. So that's one we call it a focused history taking, where it's taking it for a particular, a specific reason or a specific condition. The next type is called the comprehensive. This one is where the doctor have seen that even though it take the whole day to gather the information, you are not in haste. It will not even matter to your health. So the doctor will need to gather everything about. And this one can be done after the attending to the emergency condition. So emergency history taking, that one is done based on the urgency of the condition. Focus history taking also in most instances may also be a subtype of emergency history taking. But in this case, it's not just in emergency, just because the doctor have the condition already, but he wants to be very sure. So he'll be asking you questions that relate to that condition. All right? While the comprehensive is when the doctor gather everything, he will not leave any stone unturned. The next type of history taking, which is the fourth type of history taking, is what we call the what? The time lapse history taking. Now, this is another one that gets some people frustrated. Time lapse is because the doctor have the outcome he's looking for at the end of a specific duration. The doctor have already looked at. He said, if at the end of 72 hours, this thing do not stop. For instance, malaria, you don't have improvement. It means the treatment is not working. That is a type of time lapse history taking. Then, if at the end of 30 minutes your temperature does not start coming down, it means the appropriate thing, or it means there is another condition. That is a time lapse kind of history taking. It's taking the history based on a particular time lapse that is expecting what is looking at to happen after a particular time. That will take us to another one that looks like that, which is the ongoing. This ongoing history taking have to do with the doctor will come today, I've asked you a question. Tomorrow he come, he still asks you the same question. You may feel he's repeating himself. You may feel he's just stressing you. But it's because he wants to know there's a possibility to change the diagnosis. There's a possibility to change the medication. There's a possibility to adjust the plan. So we call that kind of history taking ongoing history taking, which is as a result of you being on hospitalization, continuous hospitalization. So the doctor wants to gather and be sure that the plan is giving the response that is expected. So which is the fifth type of history taking. So let me start again before we wrap up. The first one is what? We say the first one is what? The focus history taking, which is based on a specific diagnosis or outcome the doctor is looking for, or the clinician is looking for. The next one have to do with emergency, which is based on urgency. The third one have to do with comprehensive, where the doctor takes his time. The condition is not urgent. And then the fourth one have to do with time lapse, which is based on a duration that the doctor or the clinician is looking at. And then the fifth one have to do with the ongoing, which is Every day it keeps assessing the condition, it keeps assessing, keep asking questions to get more information. The last one is intermittent, which is in between the treatment. The doctor can come twice in that 24 hours to still gather more information. That one is called intermittent, because there's a possibility that more treatment needs to be added. So having understood all these things about history taking, do we now understand why some of the questions are asked during our visit to the hospital? So why are we having this particular aspect on our first episode? Is so that when you go to the hospital, you're on your next appointment, you feel comfortable and relaxed to answer all the questions, and you understand the reason why they are asking you all these questions. They are not asking you to stress you. They are not asking you to know your personal history. They don't want to know your personal information because they want to harm you or because they have an ulterior motive. No, that is not the reason. So mama, brother, sister, they know they ask you all these questions because they won't do you anything. Na because say they wan really understand wetin dey do you and how to attend to you. That's why dem dey ask all these questions. So if any of us have any question at this point, you can drop it at the comment box. If you have any contribution, any suggestion, please, any point you are not clear, let us know, because we're about wrapping up at this point. So for those of us who have stayed from beginning up until this point, trust me, I really appreciate. I really appreciate. Cheers, everyone. I really appreciate. It means a whole lot to me. This series will continue for a while. So whenever you see the notification to join the live stream, please do well to join. And if you have any question at any point, always do well to ask your questions. I will always be there to give the best and possible answers to every questions that are asked on this series, and I'll address it in the raw form. I'll try to use our different languages, the one that I can speak. Anyone I can speak, I'll try to my possible best. So please, if you dey connect for the first time, na your first time to visit this channel, abeg subscribe, so that as we dey continue for this series, you no go miss any point. So do well, drop your comment, drop your question as we dey proceed. No feel shy, abeg. As I don tell us earlier, our proverb say person wey dey hide in disease condition na im dey die from the disease condition. So no hide any question. Tell us the way e dey do you. We go answer all your question. So we'll be wrapping up at this point. In the absence of any question, any contribution, any suggestion, I think it has been a nice time being with us right from the beginning. I really appreciate every one of us. Your presence means a lot. Your presence makes the whole difference. And at this point, we have to say good night, everyone. Cheers.